Now, one thing I want to show you before we do the follow-up with the try-in, I just want to show you in terms of the existing denture, Robert, that looks pretty close.
Yeah, it does.
Okay.
Yeah.
In terms of the tooth size and position, so you can see here your canines are coming together nicely, the midline, and again the canines on this side.
Yeah.
Pretty much the same. So I don't think you're going to have a difficult time getting used to this denture over time. Probably within a week or so, it'll feel like it's part of your anatomy. So let's see that there. Well, what a huge difference. So if we can just take a look there, without the lower one in, just by moving the one tooth, really changes the whole appearance of the plane of occlusion. So hold it right there for me, Robert. I'm going to give you the mirror. Give yourself a look there.
Oh yeah.
It looks nice and leveled, right?
Yeah.
So it gives you a little fuller appearance here because I felt like this tooth was kind of hiding up there.
Yeah.
Okay.
This one here looks like it's tinted in a little bit.
A little bit,
yeah.
But you know what? We can always play around with it at the insertion.
Yeah.
I think it looks nicer because the teeth two out from the middle, they're kind of irregular in terms of their position. So it's quite normal to have them a little broken up.
Okay, cool.
Instead of having it almost like a flat look throughout.
Yeah.
But if you want me to change it, I'll be more than happy.
That's good.
That looks pretty good. It kind of exaggerates this tooth. If I rotate this tooth to make it a little more flat looking, it'll take away from this tooth.
Okay.
All right?
Cool.
So let's try in the lower as well. So we're just going to retract the cheek gently because you have some nice undercuts back there. Close down with your back teeth for me. Open again and relax your jaw and close with your back teeth on both sides. There we go. Good. Give me a big smile. Good. Give yourself just a gentle smile in the mirror. Are you happy with that?
Mm-hmm.
Okay, that looks pretty good.
Yeah.
That looks pretty good. Color is good.
Yeah.
We have, you know, when we grin, give yourself a grin again in the mirror. We're gonna go about halfway up the tooth or 2/3 up the tooth. When you give yourself a big smile, when you're really stressing out the cheeks here, you're gonna almost bottom out of the gingival margin. So when we do our tooth selection, if you're gonna make a mistake, pick a longer tooth than what you think you need. It's always very noticeable that when you pick a short tooth and the patient ends up smiling and you get this gummy look, that things don't quite look natural. Now, another thing we should check here is working and balancing. So I'm going to get you to hold that for me there, Robert. Granted, I'm going to change things around a little bit, but I think I'm very close to the bite. I want to assess the working and the balancing. So Robert, what that means to you, when you chew, when you're biting your food, you're not quite biting in a straight up and down motion. There's always this little side shift, right? To the right and to the left. And that is very important to us and to you. Because when you're biting with your right side, the left side needs to balance that opening. So what we working and balancing, and vice versa on the left and the right, okay? So what I'm gonna do here, I'm gonna get you to hold the mirror there, get you to open for me. Relax your jaw with your bite down in the middle. That's not it. Open for me, both sides. Close down with both sides. That's all right. Open again. Relax your jaw for me. That's it. Close. I'm going to take the mirror from you because now you're doing funny things on me. All right. All right. Open again. Relax your jaw and close. Open again. Relax your jaw. Good. And close right there. So I want you to slowly slide over towards the right side if you can. Perfect, right there. So that's pretty good. So we have nice working contact on this side. Maybe not so far. Robert's a little bit less. Right there, good. Nice working contact. And if we look on this side, I'm pressing the lower down up against the mandible. There's no movement, so it hasn't tipped out of position. And we have nice balancing contact. Let me get a little more light in here. Open for me again. So back in the middle first. Close down with your back teeth. There we go. Now slide over to the right. All right, right there. So nice working contact right along the buccal corridor. And if we go to the other side, slide over a little bit more. Okay, a little bit less now. Right there. Working contact on the right and balancing contact on the left. Slide over to the other side now, Robert. This way, come to this side. There we go. Not so much, not so much. Right there. Right there. So perfect working intercuspation and interdigitation right here. And we have a nice balancing contact on this side. One last thing I want to check here, Robert. So once again, what I want you to do is close down with your back teeth, just like that. Hold it right there. Close down first. And I want you to move your jaw out a little bit until your front teeth come together. Not so much. Right there. A little bit less. Right there. So we have incisal contact here, as well as posterior contact all along the side. So when you come forward with your jaw and you want to bite on a piece of sandwich and you cut through that, your back portion of your dentures are relatively close to each other, so they offset any tipping forces.
Okay.
Alrighty, yeah. So it looks pretty good. Looks pretty good. Now, granted, I'm going to do a check bite. We're going to do another try-in for Robert, possibly not on camera, but and then we'll go into a finish. Now, and if you have full confidence in your work, you can do a check bite, reset the teeth depending how minute the changes are, and you could go into a finish depending how you feel. All right? Alrighty, so what I'm going to do next, I'm going to take the lower teeth out like we talked about. I'm going to take this out as well and just set it on the side for a little bit, and then we'll revisit this. All right, stop that.